everyone, and welcome to another Sano Health podcast. Today, I'm delighted to speak about nutrition communications with an expert in the space. And I'm pretty sure that, you see a lot of information in social media about health. But did you know, and that's backed by several studies, that up to 50% of all this information about health and nutrition we see online and on social media is just fake, is not right. So today we're going to talk about evidence-based nutrition communication, and we will do that with Harriet Smith, the CEO and founder of HRS Communications. Let me introduce Harriet to you. Harriet is a UK registered dietitian and an award-winning medical writer by background with a lot of experience in nutrition communications. In fact, Harriet worked for global and boutique healthcare communication agencies for many years before creating her very own agency, HRS, in 2019. HRS Communications is an award-winning nutrition communications agency specialized in nutrition communication to promote health and drive positive change based on evidence. Okay, hello, Harriet. It's an honor to have you here. Welcome to the show.
Thank you so much for having me. It's honestly such a pleasure to be here, and I'm so excited for our conversation about nutrition communications today.
Likewise, it's such an important topic, and especially when we are bombarded by a lot of fake news in social media nowadays, and there's a lot of chat around, okay, this is healthy and this is trendy and all of that. And I was just checking some studies, and up to 50% of all the health related content in social media, it's just fake. It's not based in any evidence. So I'm very excited to talk to you about this today, to really speak about how we can add more evidence into communication in the health nutrition space, and discuss the challenges that we see. So let's go ahead and Harriet, I mean, you have a bunch of experience in the space. Why do you think, in first place, right, is so important to embed the evidence, and how can that be done feasibly?
Absolutely, it's a brilliant question. And as a dietitian myself, I'm incredibly passionate about giving evidence-based information to patients and consumers. And actually, for many of us as clinicians, it's part of our sort of regulatory requirements of our industry bodies. For myself, it's in the UK, the British Dietetic Association and the Healthcare Professions Council, or the HCPC. But part of being a dietitian is making sure we have a responsibility around sharing evidence-based information and knowledge. However, as you mentioned in your introduction, unfortunately, that's not the case. And a lot of information out there relating to medical and nutrition advice is just simply non-evidence-based and sort of spreading misinformation and fear. But the reason why being evidence-based is so important, particularly when it comes to information that you're giving to your patients and the guidelines that you're referring to, is that we need our decisions to be informed on data, research, and proven practices. And there's a lot of reasons for that. It can not only improve patient outcomes, but it also standardizes best practice across the industry. And it makes sure that ultimately we're delivering consistent, fair, safe treatment to patients. Referring to evidence-based guidelines can be more cost-effective because you're using resources efficiently that are proven. And it also helps to build that credibility and trust with your patient or your end user. If they know that you're credible, qualified, and referring to evidence-based guidelines, that will hopefully build trust with the end user and reassure them that you're providing them with sort of up-to-date, accurate information. But of course, we need to caveat that with remembering that guidelines continuously change and improve. And what might be a guideline today could very easily change tomorrow. But that's the whole excitement of being in the medical industry. We are continually referring to the latest evidence with an awareness that that could change, and then explaining that information in a way that resonates and is easily understood by the end user.
Yeah, definitely. I mean, what you said about the safety, angle attached to it, right? I mean, evidence has to be there in this communication. Otherwise, there's a massive liability as well. It's just not ethical. So I totally see that. And you mentioned something very interesting, which is that, there's more and more research being produced. And is it hard to keep up with, this pace? So is that one of the challenges that you see in the industry that dietitians, clinicians may face to produce the evidence-based content?
Yeah, absolutely. Something that we hear time and time again from clinicians is that they're short on time. We all have a responsibility as regulated clinicians to keep up to date with continual professional development, CPD. So we should all be undertaking regular learnings to make sure that our knowledge base is up to date. However, I'm sure lots of people listening will be able to relate to this. When you're pressured and you have lots of patients to see, lots of administrative work that goes alongside that, it's very difficult to prioritize that time for you to do your learning. So as my company HRS works with many companies in the industry, a lot of what we do is creating CPD content that's really quick, bite-sized information that clinicians can quickly engage with to keep their learning up to date. I was also going to flag a couple of ways to use technology to help clinicians to stay on top of developments in the research field, because I completely understand where you're coming from when you say it takes time to digest all this information. And we're not saying that you have to sit down and read every clinical paper from start to finish, because you'd be there forever. But there are plain language summaries which can be really useful to refer to. Quite a lot of published journals will publish plain language summaries, which are really simple, jargon-free ways of explaining the science in a brief, clear, and concise way that resonates with a diverse audience. So it might be useful for you to refer to as a clinician, or if you're trying to explain that information to a patient, then plain language summaries can be really helpful for that. And not to forget the power of AI as well. I know we talk a lot about AI in healthcare, and I know it's something that you're very passionate about as well. I won't name out all the different programs, but obviously there are lots that you can use, from ChatGPT to Copilot. Even Google have got their own kind of AI platforms where you can plug research papers into them and ask them to produce a summary of, say, 2 or 3 sentences. So you obviously have to check and make sure that what the output is correct, but that can be a really good way of saving yourself a lot of time whilst keeping up to date with the research.
Those are really good insights, and definitely about leveraging more on technology to help clinicians, dietitians to keep up to date, right? And to really add this new papers, research into the mix. Really good points about AI. As you said, I'm very passionate about the topic, and it's something from Sano perspective we are really working on. As a platform, empowering clinicians and patients, and also how we can embed these tools. But anyway, this is like another conversation we can have for this. But these are really good points. And as you were talking, I was thinking about, so what do you see in all your experience and from where you're sitting in HRS and also in the BDA, what are the most common communication barriers that clinicians may be facing nowadays? I have some ideas in mind and examples, but maybe I will start. I will let you go first.
Yeah, it's that $1 million question, kind of how long's a piece of string? Where do you start? Because I have so many barriers in the back of my head that we could talk through, but a few that come to mind and are probably particularly relevant to everybody listening. Obviously, time constraints we talked about earlier. I don't know how it compares with across the world, but certainly in the UK where I'm based, if you're going to see your GP, your kind of general practice doctor, you have a maximum of 10 minutes with that practitioner. And there's only so much you can achieve in that 10 minutes. So time is a massive barrier. Trying to get information across and make sure that you've covered and addressed all of your patients' concerns and questions in a short time period can be really challenging. And I think also sort of increasingly living in a more diverse population, things like language barriers can also be a challenge. And ways that you can overcome that could be sort of making use of interpreters if you have that within your service, Or if you're handing out resources and providing content, making sure that it's suitable to the diverse audiences that you serve. That could be translating some of the resources or getting them peer reviewed by people from that population and background themselves to make sure that the information is really relevant. Health literacy is another challenge that we see. So I was doing a bit of research before I came onto this call, and in the UK, the average reading age is around 9 years old. So that's an incredibly young age, obviously, for the average adult to be working towards. And actually, around 15% of adults are below level 1 literacy, which is a basic level of literacy needed to function in day-to-day life. So 15% of adults lack that ability to have literacy skills to function. So when you think about that in terms of your consultation with a client or the information that you're giving to them, it might be that we need to look at other ways of providing information, whether that's through visual aids, for example, or infographics. So thinking outside the box and really understanding your audience. And we'll probably come on to this, I think, in our later discussions, but also some cultural relevance as well. Like I said earlier, thinking about the diverse audiences that you serve and making sure that the information you're giving them, for example, foods that you're recommending, are culturally appropriate to that person, their heritage and their background is really important.
You're touching upon really good points here, because actually the personalization is one angle, right? I mean, someone who's coming from a different culture moves to the UK, food-wise might have very different requirements. Understanding that, right, must be key, in order to have this proper communication with the patient. And something else, and we see that a lot through the Sano platform, is actually being overwhelmed by too scientific information. And I was wondering how do you think about this? If maybe, the key is also that clinicians and dietitians, they make basically the content in simple language or simpler, so it's not too scientific. Do you see that as a challenge from your role?
Yeah, definitely. I think less is more. What we might think is a simple way of explaining something could be incredibly complex to somebody else who doesn't necessarily come from a scientific background or have that level of literacy. There are software programs, and I can send a few to you to include in the show notes, where you can actually plug content or written information into it, and it will give you a readability score so that you can see how accessible that content is. And then you can go back and tweak it and reduce the length of sentences, for example, or use less clunky words to make sure that that information is really simple and clear to understand. And even as a medical writer myself, sometimes I put content into the platform that I think is really easy to understand, and it comes back with a poor readability score. And I think, oh my goodness, how can I possibly simplify this even more? But there's always a way around it. Like I said earlier, thinking about different ways to share information, whether that's visual, via podcasts, via videos, as well as written formats. And also including your end user in the content creation process. So certainly with companies that we work with at HRS, we run lots of focus groups, advisory boards, and we also engage with kind of the end user through sort of sharing resources with them, testing, learning from their feedback, adapting the resources further to make sure it's really accessible. So there's lots of ways around it, but I think avoiding using jargon and sort of medical language is really important.
I love what you say about involving patients, the end user, into the conversation, to design, to craft those communication, the messaging. I mean, patient centricity, right? We hear this key word all the time, but it's sometimes not enough in the practical life. So I'm very glad that you have these focus groups and you involve the end users into the mix. That's wonderful. That's wonderful. I mean, obviously, in terms of keep it simple and finding different ways to create this content, social media comes to the mix. And we see that a lot, in clinicians using the Sano platform. They are on Instagram, on TikTok. They try to, have this funny entertainment, at the same time educating. And some of them are doing an incredible job, right? And still with evidence-based. So to be honest, I don't personally think that using these social media networks actually, you can still, have evidence-based content in there. But obviously that comes with a lot of work in terms of, creating the content and making it entertaining. And then I was wondering if you have any insights on this, right? How do you see the role of social media into this?
Social media is always going to have a big role in medical and nutrition information because, like you say, at the end of the day, people are going to these platforms because they provide really engaging, simple, interesting, and sort of varied content. What we see, particularly in the UK, and I'm sure it's a global issue, is that there's a real rise in celebrities and people with big followings sort of advocating for perhaps non-evidence-based practices. And because they have such a high following and they're so well respected in their other industries outside of nutrition and health, people take what they say as the gospel. And so it's creating a lot of misinformation and fear, and actually can lead to some quite harmful end results, unfortunately. So I think our role as practitioners is to have a presence on these platforms and to engage with them as much as we can, because if we don't, people are going to go to these more influential people with big followings and follow their advice. So I think it is our responsibility to, in part, address this. I think there's a much wider issue where government and policy becomes a huge part in it. But thinking in terms of what we can do as practitioners, engaging in platforms. And if you're not on platforms, then signposting your patients and end users to people within the industry who you consider to be credible sources of information. So that could be it could be other healthcare professionals on platforms like TikTok or Instagram, or it could be credible organisations like in the UK, the NHS, for example, the British Dietetic Association, to name a few. And I think it's really about sort of active listening and empathy. So if you have people come to you and say, I've seen this TikTok influencer who's talking about cutting XYZ out of the diet and it reducing the risk of this disease, not immediately talking them down, but praising them and saying it's great that you've put so much time and energy into researching your health and nutrition. However, there are some limitations. Would you like me to explain them to you in a bit more detail? And really making that person feel like you're not kind of patronizing them and condescending, but you're coming up with a solution that's going to work for them and is evidence-based. For me, it's about bridging that knowledge gap and sensitively explaining your position as a clinician and the fact that you are qualified, you have a lot of experience, knowledge, and you practice within a safe and regulated framework. And hopefully once you explain that to your end user, they will then become to sort of trust you and follow your recommendations and the sorts of people you think they should be following on social media. And also, my big passion is empowering people to think critically themselves. So you can teach them the process of assessing evidence. If it sounds too good to be true, it probably is. You can teach them about sort of looking for references and then going to look at that source of information and perhaps looking at the sample size. Is the study done in animals? Is it done in humans? You can give them some basic skills to critically appraise the evidence themselves if that's something that they'd like to do. So for me, it's about positioning ourselves as credible and authoritative and suggesting suitable sources for people to follow, bridging that knowledge gap, and also empowering people to think critically themselves.
That's great. And I mean, I wanted to ask you about, the patients, the user side, right? How they can also develop this critical mindset and assess, okay, if I see this on TikTok, is this, like, as you say, it's too good to be true? And what actions they can take to then check that further, and especially with a clinician, a registered clinician. I mean, we are going to talk in a minute about more practical, actionable insights and tips. But before that, and you mentioned something about trust, right? So it's also about developing this trust in this relationship with the patient. One of the challenges that we sometimes hear is about how to tailor some of this messaging for diverse populations. And before, you already mentioned, you hinted a little bit on this topic, but what happens when we have different populations, different cultures, backgrounds? How, as a clinician, can we deal with that?
Yeah, it's a great question and very relevant, I think, to today's society, which is becoming increasingly diverse, and we need to keep up to date with that. We're not expecting every clinician to be an expert in every religion, every cultural background, every ethnicity, because that's not possible. And I think it's really important to recognize your strengths and your limitations as a practitioner. So to give you an example, in dietetics, we often see a lot of patients with malnutrition who need food first support. So these are practical dietary recommendations aimed to increase protein and energy or calories in the diet. And if you think in terms of a typical British Western diet, you'd be encouraging patients to eat more kind of high energy, high fat foods like butter, cream, even adding sugars to their meals to increase the energy content. But if you think of other ethnic backgrounds, for example, butter, for example, might not be the main source of fat that they use in their cooking. If we're thinking of South Asian diets, they may be using something like ghee, clarified butter. So I think if you're serving a diverse population, your duty is to inform yourself about their dietary requirements as much as you can, whether that's through doing further research, speaking to the patients themselves, or maybe going and speaking to other practitioners from that background and heritage and getting them to upskill you and give you some knowledge. So for me, it's about being culturally sensitive and asking the patients about what foods they typically consume and making sure that the recommendations you're making are tailored to that. And like I said, if you don't have that information, it's fine to say to them, actually, I'm going to come back to you at a later date once I've got some more information that's suitable for you. But it's also important to avoid stereotyping. So just because someone says to you they're from a certain background, religion, or ethnicity, we shouldn't assume that they're going to eat in a certain way or live their lifestyle in a certain way, because it may be that actually they've adopted a different way of living that that you're not aware of. So avoiding stereotypes, I think, is really important. Also thinking about sort of religious and ethical beliefs. A lot of different cultures have very sort of strict ways of thinking when it comes to medicine and practices, and so it could be really interesting to have an open conversation with your end user about that. And if you're serving lots of people from a certain background or community, you could also look to engage with, for example, a religious leader in your population to find out more from them and work with them to create content which can then filter through to their population. So there's lots of ways around this. Another thing to mention, aside from sort of religion, culture, and ethical backgrounds, is social economic status. Obviously, we're living in a massive cost of living crisis at the moment, certainly in the UK, where inflation is ever increasing, and buying food and accessing healthcare and things is becoming increasingly more difficult. So I think it's really important to have an understanding with your end user about their socio and economic situation. Because if you're recommending lots of ingredients, for example, that are expensive, that might not be realistic or achievable for them. So it's really, in dietetics, when we're doing an assessment of a patient, we're taught to follow the ABCDE format. And it may have changed since I was trained a number of years ago, but I think in terms of A, which is anthropometry. So anthropometry, you're looking at body measurements, so patients' BMI, weight, waist circumference, etc. So you might have a patient who's looking to lose weight. You might have a patient who's malnourished that needs to gain weight, sorry. So it's really important to begin by thinking about that and your recommendations. Then we come on to B, which is biochemistry. So that might be looking at blood markers. Are they deficient in a certain nutrient, for example? If so, that might be something you need to factor in when you're making food recommendations. C is clinical. So do they have any diseases, any family history that you need to be aware of, because your recommendations may relate to that. D is relating to dietary. So are they vegetarian? Are they vegan? Do they have any food preferences? And then E is everything else. So that could be their economic status. Do they know how to cook, for example? Do they have dependents living with them at home? Do they have children? Do they care for people? What's their financial situation? So when you're making recommendations, it's really important to take this holistic view where you're looking at everything rather than just concentrating on one of those areas. So hopefully that gives you kind of a rounded answer to your question.
Well, it's great. And this framework, right? It sounds very interesting because of this holistic management, and a really, I think a key message, right, is having this open conversation with the patient, and don't be scared or fearful to say, yeah, I'm sorry, I don't know. Actually, this speaks highly, because then you can go back, do more research, and the patient probably feels that, you know, they care about you. Yeah, well, that's great. That's super insightful. And I think, Harriet, next, and we really start touching into it, is more practical terms. What sort of strategies would you share, the top 3, for example, to practitioners listening to us? And also, you already mentioned a bit of those for patients about being more critical with the information.
Yeah, so I think in terms of clinicians listening today, a main message is about understanding your audience. So if you're on TikTok, you're on Instagram, you've got a large following, doing a bit of a deep dive into who those people are that are following you. Is it other clinicians following you? Is it patients? Do they tend to fit into a certain demographic? Because then you can start to create your content or your messaging in a way that's really going to resonate with that target audience. And if you're in a sort of one-to-one consultation situation, as we said earlier, asking those open-ended questions and really doing active listening and finding out more about your patient, their background, and what they're hoping to gain from seeing you. So that's my first recommendation. I think the second one is around positioning yourself as that trustworthy and credible authoritative figure. You've worked really hard to get to the place that you're in your career as a practitioner, whether that's a doctor, a nurse, a dietitian, whatever. Everybody will have done, to some extent, you know, qualifications and continual professional development and be registered, I'm sure, with professional bodies. So you really need to kind of shout about that, whether that's on social media or with your patients, so that you form that trusting relationship with them, and they're more likely to obviously be compliant and work with you and follow your recommendations. And then I think finally, as we said earlier, it's about tailoring your information. So making sure that it's appropriate to your audience, whether that's from an ethical, religious, cultural, clinical perspective. And also making sure that your patient is understanding the information that you're giving to them. So perhaps getting them to summarize or repeat back to you at the end of the consultation to make sure you've understood correctly or they've understood correctly. And offering to provide information in a variety of formats, whether that's social media information, written resources, or visual formats. So I've gone over 3 there, apologies, but I think they're all equally important.
That's great. All of them are very relevant indeed, Harriet. Yeah, thank you for that. These are really, really, yeah, insightful. The understanding of the audience, the positioning, the trust, this tailoring. And I love the fact what you said last about letting the patient summarize the session, the consultation, and kind of ensure that they understood it. That's really good. Yeah, and actually talking about the patient side, perhaps you could provide a few tips, actions, where to go to find reliable information, or even check if a professional, a clinician is certified. I mean, obviously, the BDA is one of these organizations in the UK. Are there other, you know, platforms, that rectories? What's your number one recommendation for those patients listening to us?
Yeah, okay. Well, perhaps I'll speak sort of broadly around things that people can do to sort of check the accuracy of information and see if it's too good to be true. And then I can give a few examples from a UK perspective, which may differ obviously according to the country that people are from listening, but I'm sure it will apply sort of across the board. So in terms of advising your patients or consumers on how to check information, they can obviously look for references. If people are posting on social media and providing information and advice, then you have a right to go to that person and say, could you provide me with a reference or some information as to where you got your advice from? If it's obviously a written piece of content, some of these may be evidenced with a reference list at the end. So then you can look at the kinds of sources of information that they're using. You can also look up the person who's giving the advice. So if they're a practitioner and they're using words like doctor or dietitian in their title, certainly in the UK, if they're using dietitian, for example, you can go onto the Healthcare Professions Council, the HCPC, which is our regulatory body. So only anyone registered with the HCPC can call themselves a registered dietitian. So you can put someone's name into there and their location and see whether or not they're registered. And if they're not registered, but they're using that title incorrectly, then you can report them to the HCPC. So for some professions, there's a way of doing that. Certainly in the UK, I think it applies across the board for other allied healthcare professions, as well as doctors. And then in terms of if you see something that you think is inaccurate on social media, you can obviously go to like your practitioner and get their advice and input on it. So go to someone that you trust and you know is credible and reliable. I think as practitioners, if we see that there is misinformation out there, we have a duty of responsibility to challenge that person on it, ask them for their evidence, their sources. If it's incorrect, perhaps politely correct them on it and ask if they will correct the information. But at the end of the day, if they're not open for doing that, I'm seeing a lot of health practitioners now on social media platforms calling out misinformation. And I think it needs to be done in a sensitive way, but at the same time, I think, we're well within our right to call out what we consider to be harmful information. And we shouldn't shy away from that. You can report things on social media, as I'm sure many people listening are aware as well. So there are lots of different avenues that you can go down. And then in terms of trustworthy sources of information, generally charities, specialist charities tend to be a really good source of specialist information for particular conditions. So cancer research, for example, Heart UK, and then most industries will have their own professional sort of industry websites, like the British Dietetic Association, the Nutrition Society, the Association for Nutrition. So those tend to be really great sources of information as well. And then any sort of national government body. So in the UK, we have the NHS, which has a lot of health information on there. So those would be my sort of starting points. And then depending on the patient and their sort of knowledge, they could obviously start to look at more in-depth clinical information, but that's where the practitioner can come in and help to translate that information, I think. So hopefully that gives a few suggestions.
Yes, thank you. I think that's great. And we'll make sure to mention this in the notes of the episode as well for those, for anyone listening that might find this helpful. Yes, I mean, Harriet, thank you so much. It's such a pleasure to have you here. Especially, since we started to, I have been following you and your team for a while, and it's amazing to see also all the work you're doing out there to help practitioners, right, with this messaging and evidence-based positioning. There's one question I ask all my guests, which I love doing, which is, what do you do on a daily basis to take care of your health? So I'm very curious to hear what's your top number one choice?
Love that. Such an important question. I will be honest, I work from home and I sit at my desk far too much for my liking. But one thing that I do try to do every day is get outside in the fresh air and move my body, whether that's going for a bike ride, whether that's going for a walk, whether that's doing a bit of stretching or yoga in the garden. I think it's so important to just be kind of connected to nature, moving your body and getting some fresh air.
Oh, I love that. Yeah, great. Thanks for sharing it. Yeah, so important, right? To move, get out there. We sometimes underestimate the power of that. So that's really good. And yeah, I mean, Harriet, let us know then how anyone listening can get in touch with you and follow you.
Thank you so much. So I am a registered dietitian and a medical writer by background, and I am the founder of HRS Communications. So we're a nutrition communications agency working with food nutrition and medical nutrition clients to support them with providing evidence-based and tailored nutrition communication solutions. So you can find HRS on social media. We're on LinkedIn, Instagram, X, and obviously we have a website. You can also find me on LinkedIn. Perhaps we can link my profile in the show notes. I'd be delighted to connect to people. I tend to share sort of information and tips on nutrition communications. And yeah, I look forward to connecting with some of your listeners, hopefully.
That's amazing. We'll make sure to add those on the show notes. And Harriet, it's been an absolute pleasure, to be honest. I truly appreciate, the importance of evidence-based positioning. Also, your very down-to-earth and very easy actionable insights on this matter, right? And what I personally loved is having this open conversation with the patient and involving them also in the communication process in a way. So thank you for all the work you're doing and for being on the show. And I can't wait to keep following up your work.
Thank you so much. It's been great. And I think what you're doing with Sano Health is fantastic. And educating clinicians about the importance of being credible, trustworthy and evidence-based is so important. So thank you for giving us this opportunity and platform to have this conversation today.
A pleasure, Harriet. See you soon. Bye.
Take care. Bye.